Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Vulvar Disorders. Introduction. The vulva is the external part of a woman's genitals. The vulva includes the vaginal lips, clitoris, and the opening to the vagina. There are some common causes of problems you can have with the vulvar area. Treatment for vulvar disorders depends on the cause. This program will help you understand vulvar disorders. It also covers diagnosis and treatment options. The vulva. The vulva is the external female sex organs. The vulva includes the vaginal lips, clitoris, openings to the vagina and urethra. There are two sets of vaginal lips, the labia majora and the labia minora. The labia majora are also called the outer labia. The labia minora are also called the inner labia. The clitoris is sensitive tissue found between the vaginal lips. It is located at the top of the inner lips. The hood is tissue that partly hides the clitoris. The openings to the vagina and urethra are also part of the vulva. They open into an area called the vestibule within the inner lips. Inside the vestibule are glands. These glands release lubrication. Behind the vaginal opening is the anus. The anus is the opening of the rectum to the outside of the body. The area that connects the openings of the vagina and anus is called the perineum. Vulvar Self-Exam. Vulvar disorders are a group of problems that can affect the vulva. Vulvar problems may be found by your healthcare provider during a checkup. They may also be found during a vulvar self-exam. Some women do monthly vulvar self-exams to check for any changes. Regular vulvar self-exams can help you learn what is normal and what could be a sign of a problem. Wash your hands before you perform a vulvar self-exam. Use a hand mirror to look at your vulva while you sit or lie in a place that is well lit. Separate the outer labia. Check for swelling, redness, dark or light spots, bumps or blisters. Separate the inner labia. Check the labia as well as the opening to the vagina. Gently pull back the hood of the clitoris and check for any changes. You should also examine the areas around the urethra, anus, perineum. Talk to your healthcare provider if you notice any changes in your vulva. Minor and serious vulvar problems may have the same symptoms. A woman may notice symptoms earlier if she does a regular vulvar self-exam. Finding a problem early makes treatment easier in most cases. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Many vulvar disorders have similar symptoms. Some common symptoms of vulvar disorders include bleeding, burning, itching, pain or discomfort, tenderness. Other symptoms of vulvar disorders include bumps or blisters, cracks in the skin, different colored spots, redness or swelling. If you notice any of these symptoms or other changes in the vulva, contact your healthcare provider. Common causes. Vulvar problems may be caused by infections, contact dermatitis, sexually transmitted infections or STIs, cysts, vulvar dystrophy. Bacterial or fungal infections may cause problems in the vulvar area. The most common type of vulvar infections are yeast infections. In most cases, the vagina is also infected. This causes itchiness, pain, and abnormal discharge. Another common cause of vulvar problems is contact dermatitis. Contact dermatitis is inflammation of the skin. It can be caused by soap or detergent, vaginal deodorants, lubricants and spermicides, allergic reaction such as a reaction to condom latex. Symptoms of contact dermatitis are redness and itching. Sexually transmitted infections or STIs can also cause vulvar problems. Genital warts and genital herpes are the most common STIs that affect the vulva. Genital warts are caused by a virus called human papillomavirus, or HPV. HPV raises the risk for certain cancers, including vulvar cancer. Genital herpes is caused by a herpes simplex virus, or HSV. Like HPV, the HSV virus stays in your body for life. It can cause sores on your genital or rectal area, buttocks, and thighs. Most people have outbreaks several times a year. Cysts can also affect the vulva. Vulvar cysts happen if glands in the vulva become clogged. The glands make mucus. If the mucus cannot exit the gland, a cyst forms. It can cause pain, redness, and swelling. The Bartholin glands are located at the opening of the vagina. They make mucus and help lubricate the vagina. These glands can get plugged or infected, resulting in another type of cyst known as Bartholin's cysts. Vulvodynia is unexplained vulvar pain. There is no known cause for the pain caused by vulvodynia, but there are treatments available to lessen the pain. Another vulvar disorder is vulvar dystrophy. Vulvar dystrophy is when abnormal skin grows on the vulva. This skin may be too thin or too thick. Symptoms include itching or burning, as well as redness or whiteness in the affected area. Vulvar cancer is also a possible cause of vulvar problems. Possible signs of vulvar cancer include bleeding or itching. There may also be a lump or tenderness in the vulva. Diagnosis. To diagnose a vulvar disorder, your healthcare provider will first ask about your symptoms. They may also ask about your personal and family health history. A physical exam will be done. Your healthcare provider will check your vulva for any signs of disease. If the skin of the vulva looks abnormal or a lump is found, a biopsy may be done. A biopsy is the removal of cells or tissues so they can be viewed under a microscope. This can help diagnose vulvar dystrophy and vulvar cancer. A pelvic exam may also be done to check the internal female organs. This may be helpful if a yeast infection is suspected. It can also rule out other causes of your symptoms. To diagnose a yeast infection, a sample of discharge may be collected during a pelvic exam. This sample is examined under a microscope to look for signs of yeast. If contact dermatitis could be the cause of your symptoms, your healthcare provider may ask you about products or substances that have come into contact with your vulva. Other tests may also be used to diagnose vulvar disorders, such as testing for STIs or other infections. Treatment. Treatment for vulvar disorders depends on the cause. Some vulvar disorders are easier to treat than others. To treat a yeast infection, practice good hygiene. Antifungal medicines can cure yeast infections in most people. Medicines are available both over the counter and by prescription. Vulvar cysts often may be treated at home by applying warm washcloths and wearing loose clothing. Sometimes, though, the cyst will have to be surgically opened and drained by a healthcare provider. Vulvar dystrophy may be treated with creams or ointments. This disorder usually requires long-term treatment. Surgery, radiation therapy, and chemotherapy may be used to treat vulvar cancer. Medicines, surgery, and other treatments may be used to treat other types of vulvar disorders.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The vulva is the external female sex organs. The vulva includes the vaginal lips, clitoris, openings to the vagina and urethra. Vulvar disorders are a group of problems that can affect the vulva. Vulvar problems may be found by your healthcare provider during a checkup. They may also be found during a vulvar self-exam. Some women do monthly Vulvar Self-Exams to check for any changes. Regular Vulvar Self-Exams can help you learn what is normal and what could be a sign of a problem. Talk to your healthcare provider if you notice any changes in your vulva. Minor and serious vulvar problems may have the same symptoms. Many vulvar disorders have similar symptoms. Some common symptoms of vulvar disorders include bleeding, burning, itching, pain or discomfort, tenderness. Other symptoms of vulvar disorders include bumps or blisters, cracks in the skin, different colored spots, redness or swelling. Vulvar problems may be caused by infections, contact dermatitis, sexually transmitted infections or STIs, cysts, vulvar dystrophy. To diagnose a vulvar disorder, your healthcare provider will first ask about your symptoms. They may also ask about your personal and family health history. A physical exam will be done. Your healthcare provider will check your vulva for any signs of disease. Treatment for vulvar disorders depends on the cause. Some vulvar disorders are easier to treat than others. Thank you for using Explain.